Okay, so the White Coats are an initiative that Northampton General Hospital is introducing, and I think they're a great idea because they help us to look really smart, and I think they look really professional. It's really good because it's going to help patients be able to identify us more easily as doctors, so they're going to know who to talk to, and say we're in the corridor and there's an emergency or something like that, it will be really easy for people to identify us and know who the doctors are. We should definitely be introducing ourselves to patients all the time. There's a recent campaign called Hello, My Name Is, which is where we should all be going up to patients and saying, for example, hello, my name is Emily Maile, I'm one of the junior doctors on the ward, we're going to see you this morning. And I think that's a brilliant initiative, and you might say that that doesn't need the white coat, but I think that the two together are really good. And also, if you're just on the ward and you're not necessarily going up to that patient to see that patient, but they want to speak to you, then the white coats will help them identify you on a busy ward. The white coats will also be brilliant for those patients who might find it more difficult to know who their doctors are. So for example, when we go to see patients who might have difficulties in hearing, or they might have learning difficulties, I think it's a great idea with the white coats because white coats in this country are associated with doctors. I think a lot of people know just by seeing someone in a white coat that they're seeing a doctor. So I think it's a really good visual reinforcement after we've introduced ourselves and explained who we are. These new white coats, they're short-sleeved white coats, which means that we can stay bare below the elbows, which is really important for infection control. They've also got nice big letters on them saying that we're a doctor, but also what grade of doctor we are, because that can be quite confusing. There's lots of different grades of doctor, right from an FY1 as myself up to a consultant. On the back, it also says doctor in big letters, so I think that's, again, makes it really easy for people to see who we are. We've also got really big pockets on the front, which is mainly for the new technology that's going to be introduced in August as well. So all junior doctors are now going to get iPad minis, and this is so that we can get automatic alerts through a computer software system that tell us if our patients are deteriorating or if they're unwell. So that's absolutely brilliant that we're going to get that technology, and we're going to have somewhere to carry it as well in the white coats.